Welcome to the January 8th Sandag Board of Directors meeting. I am proud to be joining you today as the new Sandag Chair. 2021 is already proving to be a momentous year, and I am excited to work with each of you to move our region forward. And I think the items on today's agenda really help to show us the importance of Sandag as the region's convener, not only for those of us who serve on this board, but also for our stakeholders and the public. The conversations that happen here matter for everyone who lives, visits, and works in the San Diego region, and today's conversations demonstrate that. And so with that, let's start with the Pledge of Allegiance. I think we'll put up the flag, and please join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, I'd like to confirm with the clerk that we have a quorum.
Yes, Chair, we do have a quorum.
Okay, and do we have any public comments?
I'm sorry, Chair, my audio went out there for a second. Could you repeat your question?
I said, do we have any public comments?
No, I don't see any hands raised.
Okay, then we will go to member comments. I see Mr. Gary Bonelli. Yes, would you like to make a comment?
Thanks, Chair Blake-Spear. It's that time of year where we have leadership changes. So at the Port of San Diego, for the information of the board, Michael Zucchet from the City of San Diego is the new chairman of the board for the Port of San Diego during calendar year 2021. I'm also happy to report that in National City, the National City Council selected Sandy Narano to serve following the big shoes of Duki Valderrama as the port representative from National City. And very germane to this board, you're going to be losing, hopefully around the 1st of February, your DOD, Department of the Navy representative, Joe Syverson, because Joe's been selected by us to be our new president and CEO. And I'd ask you all to congratulate Joe with me and maybe give him a little round of applause for stepping up and going to do a great job for our port. Thank you for letting me make those messages, Chair Blake-Spear.
Yes, well, thank you for the update. Mayor Jones.
Good morning, and I'm so excited for you, Mayor Blake-Spear. Thank you for taking charge of the agency. I just wanted to bring up one thing, and that is we really need to be mindful of transparency. Last week we had on Friday the PowerPoint for our item number 3, I believe that it is. It was posted. I didn't happen to see it. My staff did. And then on Tuesday, when I went to look Tuesday morning, because I wanted to be prepared for today, I noticed that there was no information up. There was not a PowerPoint. So if we could just make sure that we're not posting it on Thursday afternoon, and making sure that if we do have a change, that we are making a notation of that. I think that would be very helpful for transparency. And that's all today. And welcome everyone. It's great to see all the new faces on the board.
Well, thank you for that. And I think just for better communication, when there are times when the full agenda with the PowerPoints can't be posted, we could send an email to the board members to let them know. I did authorize that we could be a few days late because of the holiday, and it was difficult for staff to get everything together before that in terms of the posting. So, but we can, I think it's a good idea to send an email to the board members to just let people know the schedule so that we're all on the same page about what's happening. Okay, so let's see. I did see Mayor Gloria's hand up, but then it went down. Or was that on purpose?
Yep. Well, actually, I will take the opportunity, if I may, just to congratulate Joe on his selection. I have long enjoyed a relationship working with Joe, dating back to my days as a staffer to Congresswoman Davis. I really appreciate his leadership on a multitude of issues within the city of San Diego, in particular, the Navy Broadway complex, where we have a new Navy headquarters, thanks to Joe's persistence, and is soon to have a major tech hub in downtown. Joe, I think that you are an excellent selection for the port, and look forward to continuing to work with you on major projects like the Spay War headquarters to serve as a linchpin for our future regional transportation plan. But again, congratulations. It's a major development, and I think we're very fortunate to have one of our board members transitioning to this leadership role at the port.
Well, thank you very much for that. I would also like to welcome our two new supervisors. We have Supervisor Tara Lawson-Remmer. Would you like to say a few words?
I don't want to take up too much time, but just really excited to be here, and excited for a new direction in the work that we're going to be doing together in the coming year, 2, 3, 4, and looking forward to contributing. So it's really an honor.
Well, thank you. And we also have Supervisor Nora Vargas.
Yes, good morning, everyone. I'm so excited to work with all of you, particularly all of my colleagues in the South Bay. I'm here with you in my capacity as co-chair of the COVID subcommittee, and we'll share some information in a bit.
Okay, thank you. And I think we have Supervisor Joel Anderson. Is he on here? I'm not seeing him, but if he does come, let's give him let me know, and we'll give him a minute to introduce himself. And then Council President Jennifer Campbell, have we heard from you at this board?
Hello, yes. Last meeting was able to say hello and Happy New Year and happy holidays. And I'm really looking forward to serving with all of you.
Okay, thank you. So I know we have a handful of cities that will make their appointments over the next week. So we will have new board members and be fully seated with our board at our meeting on January 22nd. So for those of you who we might not be joining us in the future, we just want to really say thank you to you for your participation and service and contributions to our board and to our entire region. Are there any other comments from our members before we move on? You can put your hand up. Okay, Councilmember Kranz.
Yes, good morning. Thank you. And it's great to see you sitting in the chair. This morning I wanted to just make mention of the fact that, like many essential businesses, we at North County Transit District are having some challenges with the pandemic and staffing levels. And I would like to just make everyone aware that as we implement some possible COVID staffing emergencies, that some of the routes could experience some delays and some reduction in service. So we will, of course, communicate to jurisdictions in our region, but I did want to make everyone aware that indeed the essential services of public transit, which are critical for many of the essential workers that we see manning our stores and hospitals, we are experiencing some fairly emergent issues as a transportation agency.
Okay, thank you for that update. Mayor Gasterland.
Hi, I wanted to just say two things. One is it's such a pleasure and an honor to be here with all of you. This is my second board meeting, but the first one of the new year. And I'm thrilled that we have our Mayor Catherine Blakespear from Encinitas as our chair. And it's great to see some familiar faces here, including Tony Kranz from NCTD. And the second thing I wanted to mention, I don't know if this is a moment to say it, but we are in a COVID surge and the hospitals are getting so full. And I've spoken with families, my own family is experiencing this, but when your family member goes into the hospital, please know that FaceTime is the very best way to be in touch, and we can help and manage and be there for our family members through FaceTime. So if you don't have FaceTime, find another video way. So I wanted to just put that out there and remind everybody in this time of COVID. Thank you.
Okay, Mayor Sotelo Solis.
Buenos dias, everyone. Happy Sandag Friday. Yay. Here we are, 2021. I just want to, again, give my congratulations to the Alcaldesa Blake Spear as our chair, to the new board members. Welcome. It's Sandag. I didn't do it, but staff has deemed it as what Sandag Friday, because every Friday will be consumed by Sandag from now until, forever. But I think it's a great opportunity. Look forward to great projects, but also to shout out to Joe. Look forward to working with you there at the port, all of the new port commissioners, and a special shout out to all of our Sandag staff who have been working extremely hard over the break and gearing up for this new leadership, both here within the organization, countywide, statewide, and even federally. We're looking forward. So thank you to Director Grata for his leadership and all of the team. We're ready to do this. So thank you again. Felicidades and welcome. Happy 2021. I feel like I haven't talked to you guys in over this year. So yeah. Look forward to it. Take care.
Okay, great. Now we have our executive director's report from Hassan.
Thank you, Chair Blake Spear. Good morning to all of you. Happy New Year. Congratulations, Chair. This is your first meeting as chair of Sandag Board. We're looking forward, my team and I are looking forward to working with you in the next couple of years. I also want to welcome the mayor of the second largest city in California and eighth largest city in the union, Mayor Gloria, Council President Jennifer Campbell. Welcome the two supervisors, Tara Larson and Nora Vargas, all of you returning and all of the new member, Mayor Casterland. We will be able to say on the 22nd, have you all, the new board member, and we'll do our thanks there. I want to thank the outgoing chairman who's still here with us, Chair Vass. Thank you for the last 2 years. Were challenging but fruitful for the agency. This year is going to be an exciting one. We're going to do amazing things. This year, you will be cutting the ribbon for the largest infrastructure project in San Diego. That is the Mid-Coast Trolley. That project will guarantee a one-seat ride from the border to the University of California in San Diego. That ride will take less time pre-COVID than driving on the 5. That is how we want to define transit in the future, competitive with the automobile. A choice for people to take because it's convenient. In addition to that, we will be adopting in November our 5 big moves, our regional transportation plan. And I can tell you in the last couple of months, we have meetings with every state agency you can think of, with the governor's office. And I think this approach we're taking in San Diego is going to be an example for the rest of the state and the nation of how to move forward in this time with transportation planning. We also will continue working and coordinating with state and federal agencies. As I reported to you last month, we received $177 million, our region did, from the California Transportation Commission to do amazing things for San Diegans. We gonna be moving amazing project, and you will hear about them today. Even while celebrating the new year, it's a solemn time. We have witnessed moments of darkness in our nation this week as the US Capitol was overrun by a mob. It was deeply disturbing and a stark reminder of America's long history of inequality. But I'm confident we have better and brighter days ahead, and together we can make that happen. At your next meeting on January 22nd, we will be bringing to you a statement outlining our commitment to equity in everything we do at Sandag. Shortly before the holidays, a team of Sandaggers worked really hard and were tasked to put that equity statement together. I am so proud of them and the amazing work they did. We recently established our Employee Diversity, Equity, and Inclusion Council, DEI for short. The council reviewed the statement and made comments. We share the statements with our sister agencies and community organizations. Yesterday, we presented to the Community-Based Organization Working Group. We presented to the Social Service Transportation Advisory on January 19th. The statement is only the beginning of our commitment to develop an action plan. Statement doesn't mean anything unless you follow it by an action. And that action plan, for many of us, will be a first time dealing with. That would mean that our priorities could change. It is important to do things to overcome the sins of the past, but also moving forward to make sure everyone has an access to a transportation system that works. I commit to you with my team, and obviously the decision will be yours at the end of the day, that we'll do everything possible to bring to you a transportation system that takes social equity to a new height. It is a personal journey for me and also for my team to make sure we are an example to the rest of the state and the country. On January 22nd, also, you will be hearing from our Director of Mobility and Innovation, Antoinette Mayer, about digital divide. Simply, there is a gap right now, technological gap between people who can reach opportunities through the internet, through broadband, with computers and smartphones and others. And we want to bridge that gap. And we're partnering with agencies throughout Southern California, with supervisors from the 7 counties signing a memorandum to cooperate. Our supervisor, Nathan Fletcher, was a participant in that. But we are gonna bringing to you a resolution to adopt. So we work with the private sector to put that brand, but like we do transportation. I am happy to report to you today that our agency, Sandag, our region, received $9.3 million from U.S. Department of Transportation to deploy technology at the border. First of all, this is such a competitive grant. Total nationwide was available 49.8. We're the second largest of this grant. We're the only one in California. And this grant just simply says, this is a very small down payment on the 5 big move. One of the 5 big move is the next operating system. The U.S. Department of Transportation recognizes Sandag for its ability to look at that future transportation, future mobility. For that, Antoinette Mayer, our Director of Future Mobility, and Julie Wiley, our Director of Grants, should be thanked. I'm so grateful to them. They put a grant that the federal government couldn't say no to. Let me just conclude by saying something about Joe Stuyvesant. I worked with Joe for most of my tenure here at Sandag. I am honored to call him a friend. I am honored to call him a partner. We moved the NAVWAR project because of people like Joe. I think while I'm gonna miss having him at Navy Southwest and to continue to move this amazing project, the NAVWAR project, forward, I'm also happy that he's not gonna be far. He's gonna be the president and CEO of the port. But I couldn't tell you how trustworthy of a man he is. We're gonna celebrate him at the next meeting, but congratulations, Joe, you're in Denver. And I know as I am, we are committing to moving the NAVWAR discussion project forward. Mayor Blakespear, thank you. That concludes my report.
Okay, thank you. Do we have any public comments on this item?
No, Chair, I don't see any hands raised.
Okay, great. Then we will move on to our first report of the day. So we're very pleased to have a presentation this morning to talk about the county's response to COVID-19 in the San Diego region, and in particular, the county's vaccine distribution and phasing plans, and what role, if any, our cities have to play in this effort. And I just want to give a recognition to Mayor Dedina, who originally had this idea. And when he mentioned it, I immediately thought back to the Hep A crisis, because I was a new member of the Sandag board at that time. And when the county came and presented about our unsheltered individuals who were suffering tremendously with Hep A, we had a presentation, and I went back to my city after that and said, we need to have porta potties and hand washing stations. And we ended up hosting vaccinations at our city hall as well. And that all stemmed from having a presentation at the Sandag board, because there are many of us as elected officials, all 18 cities are here, who are reading the newspaper, paying attention, but aren't exactly sure what the city's role could be. And so I'm hopeful that today's presentation will involve a particular focus on what it is that cities can do, if anything, to help get this vaccine distributed and do it in an efficient way and an equitable way, and make sure that it's hitting the streets as soon as possible. So another member of our a new member of our Sandag family, Supervisor Nora Vargas, has come here this morning to introduce this item. So I will hand it over to her to say a few words. Supervisor Vargas.
Good morning, Mayor. Good morning, everyone. Thank you to my mayor, Sister Dina, for bringing this up. So in my capacity of co-chair of the COVID subcommittee, I wanted to be able to share here with you a couple of items. I think now more than ever, we need to be able to work together as local jurisdictions to ensure that our communities are understanding where we are with the pandemic. What we know right now is that our hospitalizations are up, ICUs are overwhelmed, and we have a lot of more cases on the contagious UK strain as well. And so we are working hard, and first week on the job, trying to make sure that we do everything we can. And I have to say that I've been very pleased of the work that we've been doing in partnership with Nick Machoni, our Director of Health and Human Services. There's a lot of work that's being done around the vaccines, stepping up on enforcement as well, and really trying to do everything in our purview to make sure that our communities understand where we're at. And so it is my honor to turn it over to Nick to give you an update on where we are with COVID, with the vaccines, and some of the work that we are doing. And we're looking forward to continue to work with all of you together.
Thank you, Supervisor Vargas, and good morning, everyone. Happy New Year. We thought we would give you a very quick update on our role, where we are in the region with the COVID-19 vaccine, and really have the time for questions you may have. Joining me is Dr. Ankita Kadakia, who is our Medical Director for TB Control, Refugee Health, and Infectious Disease Physician, who also serves as the Tri-Chair of our County COVID-19 Vaccine Clinical Advisory Group. In addition, Dr. Denise Foster, who is our Chief Nurse Officer for the Health and Human Service Agency and is leading our clinical branch of the vaccine rollout, and also Jennifer Branch-Raccoons, who is a Director with the Health and Human Service Agency and is leading the logistics and operations. With that, I'll turn it to Dr. Kadakia, who will talk about the allocation. Oh, Dr. Foster, sorry. Yes, Dr. Foster.
Yeah, good morning, everyone. Thank you for allowing us to talk to you a bit about what is going on with vaccines. I'm going to quickly go through the allocation process. Next slide, please. Thank you. So the allocation process starts with the Centers for Disease Control and Prevention, CDC, and they allocate a certain amount of vaccine to the states based on population and ability to vaccinate, and then also considering rates of transmission. Then the Department of Public Health, the CDPH, opens up enrollment to clinical providers who can sign up to be COVID vaccine providers. This is unique to this particular vaccine. Then CDPH determines the number of vaccines that come to the local regions based on the information that's been entered into COVID Ready, which is the sign up for providers. And then that information comes to the county, and the county then allocates, which to clarify what that term means, like basically reserves a certain amount of vaccines to supply to the COVID Ready enrollees. So next slide, please. So vaccine gets directly shipped from the CDC to a number of federal entities, including the military and other federal healthcare agencies, and then also to the Pharmacy Partnership Program, which you've heard of with the CVS and Walgreens, which are providing vaccines to long-term care facilities and skilled nursing facilities. It also directly ships to some of the COVID Ready enrolled providers, and then also ships to the CDPH. And there are also what we call multi-county entities. Those multi-county entities are large medical systems such as the UC Health System or Kaiser, which cross across the state. And then we also, as the County of San Diego, receive vaccine. And then with that, we can distribute vaccine to a number and supplies that come with the vaccine to a number of COVID Ready providers as well. So there are community hospitals and clinics. Next slide, please. And Akita.
I'm going to be speaking to you about COVID-19 vaccine prioritization. So this prioritization comes to us from the California Department of Public Health. We are currently in phase 1A. We're vaccinating phase 1A now.
If we can go to the next slide, please. Thank you.
Phase 1A includes healthcare personnel and employees and residents of long-term care facilities. This phase 1A is broken down into 3 tiers. Tier 1 are our acute care hospitals, including psychiatric hospitals, skilled nursing facilities, along with the residents who are in those skilled nursing facilities, paramedics, emergency medical technicians, dialysis centers, and behavioral health residential facilities. Tier 2 contains intermediate care for individuals who need non-continuous nursing supervision, home health care and in-home supportive services, community health workers, including promotoras, public health field staff, primary care clinics, federally qualified health centers, rural health centers, correctional facility clinics, urgent care clinics, and behavioral health outpatient facilities. Tier 3 includes specialty clinics, laboratory workers, dental and oral health clinics, and pharmacy staff that are not working in the other 2 tiers. Next slide, please. We will be vaccinating next phase 1B. This is broken down into 2 tiers. Tier 1 will include individuals who are 75 and older, and those that are at risk of working in the following sectors. These are essential critical infrastructure workers in education, childcare, emergency services, and food and agriculture. Tier 2 will be individuals 65 to 74 years of age, and again, those in essential critical infrastructure sectors of transportation and logistics, industrial, commercial, residential, and sheltering facilities and services, critical manufacturing, as well as those in congregate settings with outbreak risk. This includes incarcerated individuals and the homeless. Phase 1C will be individuals that are 50 to 64 years of age and individuals that are 60 to 64 years of age and have an underlying health condition or disability that puts them at higher risk for contracting COVID-19. Those at risk of exposure and working in essential critical infrastructure sectors as water and wastewater, defense, energy, chemical and hazardous materials, communications and IT, finance services, government operations, and community-based essential functions. Phase 2 will then be the general population over the age of 16. Next slide, please. The
county has convened the Clinical Advisory Group for COVID-19 vaccination. This is made up of the 3 tri-chairs, Dr. Gail Knight, who is the Chief Medical Officer at Rady's Children's Hospital, and co-chairs the hospital Chief Medical Officer COVID-19 Advisory Group, myself, and Dr. Rodney Hood, who's the founder and CEO of the Multicultural Health Foundation, a physician at San Ysidro Health Center, and member of the California Governor's COVID-19 Vaccine Task Force and chair of the San Diego County COVID-19 Equity Task Force. We have representatives from the county. These are made up of clinicians who are physicians and nurses, as well as from the community, our local community physicians and nurses, representing various patient populations that represent all of the individuals in the phases. The goal of this group is to help in determination of fair and equitable vaccine distribution. Next slide, please. So good morning. As Dr. Kadakia said, we are currently vaccinating those in phase 1A. Phase 1A is basically all of your healthcare workers and some caregivers who work with at-risk populations. To do that, we are asking folks to check with their own healthcare provider to see if they have the vaccine available to them to be able to be vaccinated. And since so many of these, these individuals are healthcare providers, they can also check with their employer to make sure that, see whether their employer can provide the vaccine to them or not. In addition, we're setting up points of dispensing or pods. Those pods are being set up regionally. Some are small, some are bigger. So currently we have pods in North, East, Central, and South. We have a focus on health equity as we start moving through all of these pods, as we did with testing. In addition, we're working with the healthcare sector and our hospital partners to continue to provide vaccinations to people in the community who are eligible in phase 1A. Also part of phase 1A is long-term care facilities. And long-term care facilities are being vaccinated in a couple of different ways. One of them is with a federal contract with CVS and Walgreens. They're going to long-term care facilities to vaccinate. But another way that they're being vaccinated is with our partnership with fire agencies. That's one of the ways we've been working with cities so far, is making sure that the fire agencies are aware and are partnering with us on getting vaccines out. The way that people access our pods is for them to sign up online. We've set up a website for healthcare workers to be able to be notified when their time is to be vaccinated. And you can find that on our website. For the general public, we're setting up now a robust system that will help people know when their tier is coming up. We don't have that quite yet, but we're setting it up in the next little bit. With that, I'll turn over to Nick Mascione.
So just to wrap, thank you, Jennifer. Just to wrap up, there's really 3 key things we are dealing with right now and into the future. Workforce data, and then communication and community engagement. Workforce, it's not just what you might think about nurses and vaccinators. They're critical. As been mentioned, our hospitals are impacted. Our nurse registries are empty. It's not like we have available nurses. So we are being creative. We are shifting nurses from our testing centers. We're finding nurses from other aspects of our work in Health and Human Services, and in partnership with the cities, the paramedics. We have 2,400 paramedics in San Diego and another 2,400 EMTs. Paramedics are allowed under the waiver to currently in the state of California to provide vaccine. And so being blessed to have the county-city partnerships, we're working with San Diego Fire, who's been doing training now and helping the other Metro Fires and CAL FIRE with all other fire departments, trying to, if you will, get those paramedics first vaccinated because they're in a priority group, but also turn around and help vaccinate others. And we're happy to answer questions about that. But that workforce is significant. Also working through the leadership of our Chief Nursing Officer, schools and school nurses and hospital partners You'll be hearing more about pods, as Jennifer pointed, with our hospital partners. Our goal is to have pods or these test vaccination sites throughout the entire county, like we did for testing, over 43 different locations. And so we know we need to be in all parts of our county. We also know, looking at the data and using a health equity lens, there's parts of our county very adversely impacted in South Bay. And so just like in testing, we're trying to ramp up appropriately where the vaccination sites are in South Bay, throughout City, San Diego, and all of San Diego, including our backcountry area, simultaneously. Also, as it relates then to data, this is a challenge, as it's been presented, of how this was created. Unfortunately, this was not well designed, and it was not of our doing at the local level or the state level. But how this data comes in is fragmented, and some of it's missing. So we are doing our best to bring that data together, working with the state to try to create like we do with T3, a vaccine dashboard, and we're hoping to release that relatively soon. We have some information we can share with you, Q&A, but we need to have the data to know how well we're doing and where we're doing that, and that is clearly important work that we're leading through our board subcommittee. And lastly is communication and community engagement. And this also is very important, where we need your support. I think we need to hear all voices to deal with, not only navigate where to go, but we know already there's quite a bit of vaccine hesitancy. Polls are showing that only 60% are willing to take the vaccine. And so we know we need to get much north of that to reach herd immunity, to protect our region, and to get through COVID and save lives and restore our economy. So those voices become important. We're starting by providing trusted information. This is the website. You could see our county website. We're providing information there. But also as it relates to communication, we know you're getting lots of questions. We're getting tons of questions of when is it my turn? How do these tiers work? It is quite challenging. And so we are, there's been nothing developed. We are developing it ourselves through the leadership of our board subcommittee to have one location where people can register and can give their information, and then it could tell them when we think, or when they are available, or when their tier is up, or when their time is ready to get vaccine, and then what to do and where to go. One source. So we're rushing to get that stood up, and we're working on that. And that'll be released relatively soon in the coming weeks. We know that will be extraordinarily important. But right now, to end, we are in phase 1A. There's nearly 500,000 people in the phase 1A in healthcare. And we know we have weeks worth of work to get to those folks and standing up our pods throughout an entire county, and some, I think, very dynamic announcements that we'll be making around real significantly expanding the capacity of vaccinations that we're going to be doing with our partners. So with that, this concludes our presentation, and available to any questions Madam Chair or members of SANDAG may have.
Okay, well, thank you for that. I'm sure there are people who have questions on the board, but let's see if do we have public comments, Francesca?
No, Chair, I don't see any hands raised from the public.
Okay, I see Mr. Gary Benelli has his hand up.
Thank you, Chair Blakespear. You know, we've had wonderful success in our region over the years, especially during fire season, to partner with our Navy Marine Corps team in fighting wildfires. Naturally, a lot of the military folks, every military unit in San Diego and the big hospitals up at Camp Pendleton and Balboa have numerous qualified corpsmen that can get vaccines in people's arms. I was wondering, there's probably a lot of federal law involved, but I was wondering, in an emergency situation, can we partner with our military, our community military here, and have those folks, those skilled corpsmen, help us out get vaccines in people's arms?
Gary, excellent question. The answer is yes, we are reached out. They are still now vaccinating their own. So they're still in this phase 1A, and in fact, they have different phases for the military and the VA. So they're still trying to vaccinate all of their members of our active duty and our veterans. I will tell you, though, they get vaccine directly. We do not know how much vaccine and how many people are vaccinated. they do not participate, and nor have they in the past, in our San Diego immunization registry. It's one of the best registries we have in the state, where we put all of our information. That does not include the VA or the military. We have asked if we could. That request has been made, even to Congressman Scott Peters to help, even with the VA. That yet has not been resolved. But to your point, yes, we have made the request to work with them. And perhaps at a later point, when they've gone through their vaccinations, they may. But at this point, they're not.
Thank you.
Thank you. I just wanted to ask a question about the numbers. So in the newspaper this morning, which I'm holding right here, it says that 120,000 vaccines have been received in this county, but only 51,000 San Diegans have been inoculated. And then it clearly states that there are 500,000 healthcare workers. So what is the problem there? I mean, can you just address the nut of that? Why is it not happening just a lot faster, given that we have the vaccines in this county?
Thank you, Madam Chair. I'll have Dr. Foster speak to that.
Yeah, thank you, Madam Chair. So received means that they've been shipped, and that is a portion of the individuals that, as Nick Mascione mentioned, we only know what is shipped to the hospitals that are registered through the state, so not the federal entities. We identified in Tier 1, in Phase 1A, Tier 1, which was those acute care facilities. That was the first group. That had about 80,000 workers in there, and that is representative of what that 50,000 is. And we just this week started to open Tier 2 and 3, which is a far larger volume of individuals, and we don't have the numbers updated on that yet. And again, there is usually a bit of a lag with getting that information in terms of it has to be entered into the registry, and then we have to get accessibility to it.
Madam Chair, I'll just also add to Dr. Foster. It's the latest we got, I just looked, was it's about 60,000 that are registered in our San Diego immunization registry. Again, we're just completing week 3, and we came through holidays, and everyone's been working through the holidays, but it's only been week 3. So it's unprecedented of even how fast we're trying. We need to do more, and there's no doubt, and there's a push on that. Where we're just now beginning to enter week 4. And the rollout for hospitals has been challenging because they've been doing tremendous amount of patient care with the number of COVID patients and what they're dealing with ICU. And they're then having to also do vaccinations. So there's tremendous amount of pressure, not just on the hospitals, but also our community clinics and physician practices. So everyone's been impacted, if you will, but they are moving as quickly as they can on the vaccinations. And I think what you'll see in the weeks to come is numbers being much more increased than what the rate is currently in the last couple of weeks.
Okay, so do you really feel that there is appropriate urgency? It sounds like what you're saying is that all the individual healthcare systems are managing the distribution themselves, but is there appropriate urgency that's being applied to this to get it out?
Madam Chair, and every CEO I've spoken to, there is definite urgency. Having spoken to just recently Jane Finley from Kaiser Permanente, they have a lot of members of our governmental city and county. They have 620,000 lives in San Diego. They're hard at work thinking about how they're going to get to all their members. So every single hospital, and they're not only taking care about their employees, they are now also partnering with us to help broadly in the community. We'll be later today making a major announcement with Chairman Fletcher and some partnership we have with a major health system to do something unprecedented in terms of the volume of vaccinations. And so that's forthcoming. Those are the partners that are stepping up because they're able to have now vaccinated many of their employees. Now, let me pause and tell you that what we're seeing for hospitals is something between reports of 70 to perhaps 80% of hospital employees who are opting in to get vaccinated. So one might think in a hospital where they're seeing tremendous amount of tragedy with COVID, there would be a higher. So if we're seeing that level in hospitals, obviously when we roll out to the general community, when we get more later into the phases, we're going to have to really work hard to get the public to believe and to get vaccinated when their appropriate time comes up.
Okay, thank you. Mayor Gloria.
Thank you, Chair, and thank you for asking that question. I think that's the question that's on everyone's mind is how quickly can we do this? What can we do to speed this up? And I appreciate you putting that out there and the responses from the county reps. I want to thank Supervisor Vargas for convening a group of us yesterday to give us some of this information, and then of course Sandag for hosting this today under your leadership, Chair Blakespear. I want to just acknowledge and appreciate the county's collaboration with our city's fire department to inoculate or vaccinate, I should say, our firefighters, paramedic, EMT, and the city's partnership back to have those individuals serve as administrators of vaccines. The county is well aware of my administration's commitment to using city resources, facilities, and personnel to get these vaccinations to our population. And I look forward to continuing to do that. And as Nick mentioned, ramping that up rather significantly, hopefully here in the next few days. That said, if I can ask the county, two questions. One is about geography and one is about a specific vulnerable population. From geographic perspective, we have a big city, but when you look at the zip codes within our city, the experiences of this virus are very different. And I recognize that the sequencing as currently offered doesn't necessarily reflect that. I'm curious for some comments with regard to the acuity of virus experience in our southern neighborhoods, and particularly in our more concentrated Black and Brown communities. And then in terms of the vulnerable population, I'm concerned about unsheltered San Diegans living in congregate settings. I recognize their sequencing is maybe not where I'd prefer it to be. I'm curious if you can comment on that. So geography and the unsheltered population living in congregate settings.
Thank you, Mayor Gloria. Absolutely, and thank you for your partnership and with other mayors who have been partnering with us. Where we have latitude, where we together as partners, county and city, in the unincorporated area, to put our pods, our points of dispensing, or vaccination clinics. I give the classical example, what we did for testing. We looked and worked with our community groups, our community leaders, and our city, all the city leaders and others to help define, looking at the data and where the need is. So, for instance, in the Tubman Chavez Center, that is a high volume testing site. That is clearly a location that we are giving heavy consideration. At what point do we try to shift to do vaccinations there, clearly when we get to the community level. So there's been a lot of thought going in. This is the work that Jennifer and her team does, looking at the data and working with our partners. We can't do it alone. So again, we can't thank you enough about helping us with locations, especially when we start getting into these large mega pods where it's drive-throughs. We need big spaces. But we're going to have all types, walk-ups, drive-ups. Not everyone has a vehicle. So that's why we have to be in communities. We are, the county pods are typically in locations where we have county facilities, live well centers, and already in the communities that we are serving in our safety net services. So all the additional pods that we're going to be adding through the county will be clearly with the health equity lens in those communities. So that is what we have done for T3, and that has served us well, and that is what we propose to do with vaccinations. But again, that does not mean we're not going to have vaccination clinics in all the North Coastal cities or the unincorporated. Absolutely. We have to get everyone, as much access to it. But in areas that are adversely impacted, there's great acuity and sensitivity of urgency. As it relates to the unsheltered, you and I have deep passion in helping our homeless. And I couldn't agree more. It perplexes me quite a bit that our unsheltered homeless in the facilities that we have, we've had outbreaks, managed it well, but have outbreaks, that we would not be vaccinating them earlier. That is the experts who've determined that. So I will say this, that as we go through phase 1A, it is not that we're going to wait until we get to some herd immunity level before we go to the next phase. So, for instance, we have 1,300 long-term care facilities, some of which you're helping us with and reaching out to. That's going to take us several months. The retail pharmacies, they're going to take quite a bit of time to get to the nearly 9,000 SNF skilled nursing facility residents. But I think what we will do is It's not, we can't wait. So we're going to have concurrency. And that's why Dr. Kadakia and the clinical advisory is helping look at that, so that when we reach an appropriate point, we give well notice that we're going to be opening up that next level so that we can move to that. And so we will have a situation where there are folks even in hospitals that might decide 3 months later that they want their vaccine. So they can get that, but it does not mean we're going to stop. We need to go forward because we do need to reach communities like our homeless or law enforcement or other very teachers and other important groups, and the elderly has been mentioned. So I hope that answers the question.
Can I just also add that the clinical advisory group that advises our county and our public health officer has looked at our data. We do have a data subcommittee that pulled up all that zip code data, and also we made the recommendation to have vaccination in areas where we have high testing positivity and high case rates. And we know many of our South Bay locations and neighborhoods fit that criteria. So we are well aware of the situation in the south of the city and addressing that in terms of where we're going to have vaccination pods. And then secondly, we meet weekly and we have representation from our homeless community, including organizations that provide medical care. And so we do hear from them, and that is taken into consideration of our recommendations. It's actually on our agenda for this Tuesday, and all of our agendas are found online on the county's website. And if I could add something else, Mayor, where you're at in whatever tier, so regardless of your status of homelessness or you fall in, you can get into the first tier. So we don't have to wait until you're homeless if you're 75, if that makes sense. So moving in that category to make sure people understand that the first category that they're eligible for is where they can get vaccinated.
Appreciate that. Thank you for those responses, and thank you, Madam Chair, for the opportunity to make those comments and questions. I would just wrap up by making a comment that I always want to remind people the city of San Diego is a South Bay city. I don't want my colleagues, my other South Bay city mayors to know that I don't know that. And so we'll continue to be aggressive in making sure those zip codes that are so heavily impacted are focused upon. Nick, you know that the city has a lot of real estate, places that people trust and feel comfortable going to, our libraries, our rec centers. And so we will make anything that you need available to get this vaccine out to our people. I appreciate the concern and focus on the unsheltered. And I would just wrap up by saying to San Diegans, please avail yourself of the vaccine as you come up through the sequencing. This is extremely important for the ability for us to reopen our economy, get our kids back to school. So please do your part. In addition to following the public health order, get vaccinated when you're able.
Thank you. Mayor Sotelo Solis.
Thank you, Chair. Thank you again to the county staff, Nick and the doctoras. Yesterday we did have, as Mayor Gloria mentioned, having that briefing with Supervisor Vargas, and a couple of the conversation points that I shared yesterday, I wanted to share with my colleagues today. One, it would be great to have a timeline, even if it's in general terms, for our constituents, as well as our staff and law enforcement, just so we can have a year at a glance. Because it took about 10 months to get folks comfortable with wearing facial covering or face masks. It's going to take that information to, just keep reiterating, this is where we're at in the timeline. And even if it's not as specific as you will take it on this day, I think it's really important to know that whether it be geographic or employment-based or home, your health home, I think people need to know that those are all options that are being discussed as well, of when you and where you will have options to go get the vaccine. The other thing is that we need language 101s. What is the vaccine? And I know that on the county's website, there was a comparison of the two vaccines that are out. So if there is a quick link that can be sent, again, I know that Nick, you put it out there, the coronavirus SD, if you can tell us again what the website was, I think that'd be great. But I think it's with visuals, I think it's the language and translated that we can have at a snapshot, and we can place on our own individual social media circles as individual elected officials. Oh, there it is, www.coronavirus-sd.com. Got it. And I think that that's extremely important that it be translated. And then lastly, we all as elected officials, we know a win number. You know, if we're in a win-lose scenario, which we will win against this pandemic, we want to let our constituents know if we are looking at 65 to 80% of vaccination of our constituents. I think it's really important for us to know what that win number is, or the goal. And if we have a temperature gauge or a thermometer that shows us, hey, you know what, we're at 1% or 2%. I know our PTAs do it for fundraising goals for cakes and cookies. Well, why couldn't we do that very simplistic? Let people know, and it's a visual, and each of our communities can see where we are in that temperature gauge. And I would love to see through the chair how maybe SANDAG staff, again, can help us with those visuals. I know the county has that resource, but the win or the goal of how many people need to be vaccinated, I think people will be surprised. I think to your question earlier, Chair Blakespear, if we're not knowing how fast, how and where they're being deployed, the vaccines, but also too, in the bigger scheme of things for our communities, we really need to get down to that minutia. It's, for a population of 60,000, what's the percentage? If it's 48,000, if it's 50,000, if it's 55, then we take small bites of the apple and say, okay, we need this group, we need this group, and this group. And if we all are doing it together, it makes it easier, because then, yes, the ones, communities like ours, and I appreciate Mayor Gloria's point of a city of San Diego being a South Bay community as well. We recognize that all ships will rise if we all are doing this with the same methods and goals in place. So to that end, Mr. Manchione, if you could just share maybe some of the answers regarding the timeline, and I said win number, but what our goal would be in order for us to be successful to find that immunity level. Thank you, Chair.
Does anybody on the county want to comment?
Yes, I think the right answer is as soon as possible to get to the next phase. I think that Mayor Solis is asking a great question of, and yes, we are constructing that. The difficulty we have is, putting a timeline and then managing expectations. I can tell you my best thinking of where we are and what we're standing up in the coming weeks is that we should get through a great deal of our phase 1A. But does that mean by end of this month or the beginning of February? That's the difficulty. We just don't know what the uptake's going to be as we're doing that now. I think we'll have better understanding clearly in the coming weeks, but I do believe that we will get to our one in terms of our next phase, the 1B, clearly in the tier 1 by February. When in February, though, is often the question I'm asked, and it's hard for me to give that until I have more data as we go through the tiers 2 and tier 3. Look, it took about, to give you a sense, and these are closed systems, hospitals, right? The tier 1 of phase 1A, the 88 something thousand, it took about 3 weeks to get to nearly about 60 something thousand or approach that number. And that's where they have the employees and everything else. Now we're going to be going to places and pods and work with our partners. So it just takes time. But we are, Mayor, going to create that timeline for you. I just could give you the assurance there's urgency in everything we do, and knowing that we have to quickly get through, protect our healthcare personnel, because we have to get to the other phases, particularly the 1B tiers.
And I would say, I think that sense of urgency is there, but how we share that with our constituency, that same sense of urgency comes with the education piece of what it is. If people were so hesitant and still hesitant on wearing a facial covering that is on top of their body, not in their body, we really need to start talking about, you know, the 101s now, and the infrastructure of how the vaccine will be disseminated. You know, that comes down to our fire chiefs and, you know, knowing what square footage you would need, you know, all of those details. But I appreciate that. And, you know, we need to continue keeping that sense of urgency on.
I will say, Mayor and Madam Chair, that if Supervisor Vargas is on, that is also one of her passions in terms of communication and meaningful community engagement, being culturally responsive. And that is something she is leading through the subcommittee with Chairman Fletcher. So I know that is also, we haven't talked a lot about that, but that's a great piece of our work in terms of the promoting the importance of the vaccine and with our community partners that we're working with.
Thank you. Mr. Melkatz.
Good morning, Nick. Thank you and the doctors this morning for a great presentation and a great plan. When you get to the pod strategy, how do you keep the vaccines at the correct temperature? And how do you communicate that to the public to make sure that they know it's staying at the correct temperature?
Thank you, Mel. Happy New Year. Great to see you. I'm going to have Dr. Foster mention.
Yeah, good. I'm happy to answer that. So when we take it, so it is stored in freezers until we pull it from there. And then we have special transport coolers, I'll just say. They're high grade, designed to keep it at that very low temperature specifically, but there is a clock that starts ticking when we remove it from the freezer. So we look at how many individuals we anticipate vaccinating over a period of time, and we only pull that amount of vaccine so that we're really careful about not having extra vaccine at the site. And so that's one of the reasons that we're scheduling our vaccinations. So we ask individuals to sign up and get a slotted time so that we have a head count and we know that. And the nurses only pull out, and one of the vaccines, just to answer a piece of the question, has to be mixed with saline, and we only mix as much as we're gonna use at the time with the individuals that we have. So we don't prepare a large amount up front because we wanna avoid waste.
And Mel, I appreciate that question, because you're right. The public needs to have confidence in the clinical confidence, not just what the pharmaceutical companies did in the development of vaccine, because there's the confidence there, but then the administration of that. And that's why there's tremendous amount of training and quality assurance to ensure that we're giving a very viable, efficacious vaccine. And that's why this takes a little bit more work. We're always cautious with all vaccines, but this one especially, in the way that it's the requirements for it.
Yeah, thank you. And we do require 6 hours plus of training for each individual who is being trained as a vaccinator. A lot of that is didactic learning, so that's reading materials, watching videos, et cetera. And then a small portion of it is actually doing the hands-on. But there's a lot of knowledge that goes into these vaccines, and we want everyone to be know all the details and have all the references that they have on site so that they manage it, and we have a strict adherence to vaccine integrity.
Thank you. Mayor Gasterland.
Yeah, thank you. Thanks for this presentation. For this setting, I thought I'd make a remark and then ask 2 questions. So my remark is, I have a biomedical, biotechnology research background, and I asked the question, how does an mRNA vaccine work? And what I learned when I looked at that was the mRNA molecules that are in this vaccine are lipid coated. They attach to a cell and go in, and the cell starts translating that mRNA to exactly a virus protein that the cell presents. This is a remarkable technology that's really quite recent, but well understood for cancer vaccines. So I myself, this is really the remark, I have high confidence in this vaccine. It's highly effective, and I personally intend to get it as soon as it's my turn. So I wanted to put that out there that, you know, for what it's worth, I personally have really studied this and gained confidence that this is something. And I went into a few weeks ago not really being sure I wanted to do this. So I did my own homework and I'm ready. So the two questions I have, the first one is there going to be some sort of follow-up test so that those of us who do get the vaccine, we can perhaps get some sort of antibody test to know that the vaccine worked in us and we now have protection? And then the second question I'll go ahead and ask is, with the new variant that's highly transmissible that came up in the UK, what we know is that the mRNA version of the spike protein that's in these two vaccines, Pfizer and the second one, both work against the new variant. What we also know is that UCSD and the health system, we've sequenced the new variant in samples, it's among us. So my second question for you all is, are you tracking the more highly transmissible new variant? And if not, are there plans in place to start tracking the genomes of these viruses?
Thank you, ma'am. I'm going to turn this, your great questions to Dr. Kadakia, but I will say that who just joined us is Dr. Wilma Wooten, our public health officer. She's out of frame, but she is here joining us. So Dr. Kadakia.
Okay, and Dr. Wooten can fill in for where I may not know, but there are no current recommendations in terms of checking for immunity after vaccination. It is known that Pfizer, after both doses, it's a 2-series vaccination, is 95% effective, and Moderna, after it's a 2-series as well, so 2 injections is 94% effective. One way that immunity can be checked, and we usually do this in terms of disease and not necessarily vaccination, and that's because vaccinations have these clinical trials that look at this data and check within the populations that have gone through those clinical trials for the immunity and be able to determine what the effectiveness of a vaccine is. But one way to do this is conducting antibody testing. Normally, after you're vaccinated, your body starts to develop antibodies against in case you happen to come across that infection. And so those antibodies would then be released in order to fight against that infection. Normally, antibodies form 7 to 14 days after vaccination. The same is true for Pfizer and Moderna, but of course we know that immunity builds after that second dose in order to be fully immune against the vaccine. And so if you have not experienced COVID-19 and have not contracted COVID-19, in theory, you should not have antibodies against COVID-19. So if you were vaccinated and those antibodies are checked, then that should be an indication that you have developed some immunity. But again, there are no current recommendations in terms of checking for immunity because of the effectiveness, at the level of effectiveness for both of the vaccines. And then your second question, remind me again what the second question was. It was
tracking genomes of the viruses.
Yes, so we have convened a task force. It's a subsection of our laboratory task force that meets weekly to look at the variant. And this is made up of lab directors from across our county. And so they have been tracking this in conjunction with Helix, which is one of our very large testing organizations. And so what happens is when someone undergoes a COVID test and they have a positive test, there are actually 3 proteins they're looking at, and one of those is the S protein. That drops. So what we call it is an S drop in that variant, which is called B117 variant, or that UK variant. So when that S drop occurs, these tests are then automatically sequenced. We do that whole genome sequencing in order to determine what those mutations are, and that's how we're able to tell how widespread this might be in the community. So yes, that is being tracked. There is a method being worked out amongst all those laboratories that are submitting COVID tests, so there will be more to come on that. And Dr. Wooten would like to say something additionally.
Yeah, we are working closely with Scripps our public health laboratory is working closely with Scripps. So we are randomly selecting tests that are run with the whole genome sequencing. And that's how we determined last Wednesday that there was the first local detection. And we are working to stand our public health laboratory up to conduct whole genome sequencing, and that should occur. We are trying to make it occur as soon as possible, but we are ordering the equipment and should be next month or the following month.
Excellent. Thank you very much.
Thank you. Mayor Dedina.
I just want to thank Supervisor Vargas and then the county staff for this tremendous job and getting information out there. I know that I share that same sentiment that Mayor Gloria does. I know Mayor Alejandro Sotelo Solis does. It's whatever it takes to get our communities back to normal. And so I think with that, it's great to see Mel Katz here, one of our great philanthropists in San Diego with the San Diego Foundation. I think he's on the board. But one of the great responses from the philanthropic community and the San Diego Foundation when this COVID crisis happened was this fund for COVID relief. And so, you know, I was with Dr. Walter Monk, one of our world's greatest ever oceanographers and scientists before he passed away at his home in La Jolla. And, you know, he helped plan the D-Day invasion, right? By developing the science of wave forecasting. He told me one of the best days of my life moments, he said, there's nothing that a small group of people can't do to change the world. And obviously the greatest minds in the world came together to develop this vaccine. We put science first, and then we applied it to helping save the planet. And we have some of the greatest minds in the biotech community. Mayor Gastelum, you're here, that's great. In San Diego, and some of the greatest tech minds in the world, and some of the wealthiest people and wealthiest corporations in the world. We all need to dig deep. We all need to ask them to dig very, very deep. To spend whatever it takes to help us get out of this. I want, you know, Mayor Gloria, you have access to those philanthropists. I don't really, but all of us need to get that message out. If we want to get back to normal, we need to spend and do whatever it takes. We need to write those big checks. We need, and then the tech guys, the biotech guys need to help these guys figure out what is it we aren't doing on the distribution side? What are the tech tools and methodologies that we haven't thought of because they're so busy saving people's lives and saving the planet that they can develop that can help this effort. I think that's what we're missing here is that sense of urgency from everybody, not just from the medical community and the public health community and all of us, but to everybody come together like we did at D-Day to say, what aren't we doing that we can help right now get done, that we can drop everything? Because if we don't, God forbid, we're 8 to 12 months out, our people can't sustain this. So thank you guys for the life-saving work you're doing now, but we need a lot more help. And there are two San Diegos. Frankly, there's a San Diego that has been devastated by this economically and in public health and in deaths, and that's in South San Diego. Our folks are being hammered. And then there's the northern part of San Diego where frankly, the census tracks and the census data and the data shows it hasn't been that hard. That doesn't mean there hasn't been tragedy, but if we don't get this under control, my city and South San Diego and these communities just aren't going to recover. And so our city has said, we'll do whatever it takes to make this happen and support the county. And we're going to do that, whatever it takes, whatever we have. We don't have a lot, but I think we need everybody to do that. And I think that sense of urgency needs to be imparted to those who have lots and lots and have a lot to give and can give a lot more. So anyway, with that, thanks Supervisor Vargas and all of our heroic public health staff, Dr. Wooten, and all of you and your team are amazing. And I know you've saved lives in Imperial Beach and we appreciate working with you every day. And we honor you for your service. So that is the hallmark of what we do. It's public service, right? This is exactly what we're supposed to do on this planet, is to give back and save lives and make the world a better place. And we all get to help save the planet by doing it. So thank you.
And so I guess to follow up on those comments about doing everything we can and digging deep, I wanted to just ask the county health department, you know, when you look at that pacing the pacing that we have, which you said it took 3 weeks to get 60,000 doses out within a closed system. Well, what can we do? I mean, you have all the cities in the county on this board, and we have fire departments, we have distribution of the flu vaccine, we have different healthcare systems within our cities. What can we do as cities to help speed up that pacing? I just want to press on that a bit, because it seems like that is, if we replicate that, it is going to be that 9 to 12 months. And that just doesn't seem acceptable.
Yeah, thank you, Madam Chair. And again, that 60,000 is just the ones that we report. That doesn't include others that we don't have access to the number. So it's a bigger number than that. We just don't know what it is. But nonetheless, we need to do more. I mentioned this in my earlier comments. We have 2,400 paramedics, and that includes in CAL FIRE and all our cities. Every one of those paramedics can vaccinate. If we had a D-Day moment, as Mayor Medina was talking about, mobilizing and activating, and knowing we can't at any one given time because they're saving lives and bringing people and responding to emergencies, obviously. But if we can mobilize the majority of that workforce, that would be immense. I could only imagine that if we truly had that with as many of the hundreds of nurses we are deploying, every possible nurse that we can, again, still having to do testing, still have to do patient care, but everyone else, we would be at a much faster pace. Again, I think this is the opportunity you started by how can cities help, and some already are, and we'd love to work with every city. Clearly, the ability for cities to start their vaccination for health equity in every part of the city, cities, and as Mayor Medina said, and others being more adversely impacted, focusing county efforts there as we go countywide, I think would be a tremendous support for us. I really think, again, it gets back to workforce, data, and community engagement, communication. But the workforce is still building that up in capability. I do believe by activating that type of workforce, we will be getting more vaccine. And I know that through the governor's leadership, there's a commitment of getting more vaccine. So I've been asked, well, if you have all this workforce, though, will you have enough vaccine? And the state has said, if you can build a workforce, the vaccine will be there. So that's our urgency, is really ramping up. It just takes some time to do that type of activation because of the training that's required and the certifications we have to do. But I would love to do that with every one of those paramedics. And we have done that already with some of the cities and CAL FIRE, but we can do more.
And so who's the tip of the spear on this? I mean, if we go back to our city managers and say, hey, we have fire departments of paramedics on staff, we want them to be dedicated to this effort, who should they reach out to?
So, Madam Chairman, they should reach out to me directly, and we can get you Elizabeth can send you my contact information. I've been working individually with a number of the fire chiefs and setting them up for training, and also helping them understand how to sign up as COVID-ready providers if they're interested in actually having the vaccine managed on their site.
If I can add, the other thing to be aware of is that we're already working with fire agencies through 2 collaborations. One is Operation Collaboration, which is working with the North, East, and Central fire agencies through one centralized command. And CAL FIRE is leading the charge for that, also with Chief Calderwood in Carlsbad. And then the other is San Diego Fire in the Metro Zone. So San Diego City and some of the southern cities are working through them to make sure command, is centralized, and we're working through those kind of command structures. So just want to point that out as well. So Denise, for training, but we also want to, have sort of that system in place as well.
So Madam Chair, we put Denise's email up there. To your point of where to send the information, that's the email that we provided.
Okay, so I'd like to ask that Sandag staff just put together a brief paragraph of summary for the board members and send it to us that says who to contact at the county and what it is that you need, because I feel like I'm hearing in these comments both things, like, oh, don't worry about it, we're already managing it through the fire chiefs and CAL FIRE, but then also, Denise's email. And I just want us to be as helpful as possible so that workforce isn't the hang up. If you're saying that it is, that it seems to me like there's capacity here for us to mobilize people in that direction. So if we could just get that distributed to the Sandag board members and alternates, that would be really great. And then, And then can you just, and then I'll call on Supervisor Lawson Remmer in just 1 second. But so can you just go back to that point of that you said the governor has said that there will be the vaccine. So, I mean, we have received 120,000 doses, but do we know when the next group is coming to us? Do we have any info on that?
Yes, we are slotted to receive additional vaccine as soon as Monday. We are able to put in allocations for shipments on a regular basis, almost daily. Originally, in the first couple weeks, it was really once a week, and so that was a limiting factor. But now we're at a place where we can put in requests for shipments more regularly.
Okay, and you're saying you put in the request for shipment when you have the workforce to distribute it. Is that what you're saying?
Well, it's a mixture of factors. When the healthcare systems tell us how many vaccines they want, that's coupled with how much they can store based on their storage capacity. It's also coupled with their population that they want to vaccinate.
Okay. Okay, Supervisor Lawson Remmer.
I honestly, Catherine, you said essentially exactly what I was going to suggest, that it seemed like there was an information gap, and it might be helpful for county to put together a one-pager. I would actually say probably a little more detail than a paragraph, but so sort of specific capacity constraints where the cities could be helpful, and contact information. Because obviously we're going to need to be all hands on deck, but it's hard to be all hands on deck if nobody knows what hands are needed.
Yeah, that's a good way to summarize it.
So
okay.
I think honestly,
so
you said what I was saying.
I don't see any other hands up. Okay, great, thank you. Oh, there we have, okay. Paloma, did your hand pop up and down?
Yes, sorry, I had it up, but for some reason it went down. Good morning. This is Paloma Aguirre, Councilwoman for the City of Imperial Beach and MTS representative. I just wanted to express that MTS is very eager to be a point of distribution and dispensing. We have over 2,600 public employees, most of whom interact with our riders every single day. Many of them come from communities of concern, so we need our workers to be considered as essential workers, and we need them vaccinated as soon as possible. We're ready. We've been planning to, have as soon as we get the green light to be ready, and we look forward to partnering with the county on this so that we can get our workers vaccinated as soon as possible. Thank you.
Okay, thank you for those comments. I don't see any other board members who've popped up with their hand up. I'll just give another second here before we say a big thank you to the county. And we appreciate your time and we really want to help. So please let us help. So if you can get together a one-pager and work with the Sandag staff and get that distributed to the elected members of this board and non-elected members of this board too, the appointed members, that would be great so that we can help you get what you need. So with that, thank you so much. And I think we'll move on to our next item, which is the priority projects for 2021. And I'm going to hand it to Hassan to introduce this one.
Mayor Blackspear, thank you very much. And I would like now to invite Ray Traynor, the Chief Deputy Executive Director, to go over the next item, and hopefully we'll at the end of the item, we'll invite questions and comments. So Ray.
Thanks, Hassan. For those of you that are new to Sandag or returning, welcome. We're really excited to be able to work with you and looking forward to really a number of really important policy discussions that lie ahead this year. During Hassan's executive director's report, he'd indicated that we've got a lot of really big milestone activities planned for 2021. And with the region's priority projects, we thought it'd be helpful to step through those this morning and just get you acquainted. So next slide, please. During a discussion with Chair Blakespear just prior to the holiday break, we had talked about using this first board meeting as a way of just reacquainting you with some of the highest priority work that's underway. Today's presentation also includes your CFO, Andre Dujan. We wanted to just provide a broad overview of some of these key activities, and then also let you know that over the course of the next 3 months, we're going to be inviting each of the directors that have responsibilities over these priority projects to return here to the board and actually take a deep dive so that you can all get more thoroughly acquainted with each of the priorities. So let's go to the next slide. That would be slide number 3. So just to take a look at the Midcoast Trolley, this I think, as Hassan had indicated earlier, it's the region's largest infrastructure project that's ever been undertaken. Next slide. We're moving now into the 5th and final year of construction, and work is now a little more than 80% complete. And I think the big thing that we'll be celebrating later this fall is we plan to open service, and we're really excited. This project is on time, and it's within the $2.2 billion budget. And if you know anything about mega projects, you'll recognize how exceptional it is for a project of this magnitude to remain on time and on budget. So I just want to give a big thanks and a shout out to our Midcoast team under the leadership of John Haggerty and Ramon Ruelas. Next slide. So when opened, the Midcoast Trolley will be nothing short of transformative. It's going to connect the border, downtown, UTC with a fast and reliable transit service, supporting thousands of jobs, education, medical, housing, and shopping. Stations are going to directly serve UC San Diego, the Scripps and the VA hospitals. There are 2 regional malls that are supported, along with the East and West UC San Diego campuses and several Mission Bay neighborhoods. And when we talk about improving connectivity for our communities and providing compelling travel alternatives, this is the type of project that aims to do just that. Now, concurrent with the Midcoast, Sandag's completed about $286 million in double track improvements from Old Town to Rose Canyon. And these are really key investments that increase speed. They help to improve capacity and reliability on the low sand corridor, which supports not only the coaster, but also Amtrak and freight services. Now, double tracking is really allowing 2 trains to travel in the same area at the same time. And this creates more opportunities for carrying capacity with passengers and freight, and is really critical for helping us to reduce carbon emissions and support economic growth. Next slide. Now, one project that we're hopeful that all of you are aware of is the Del Mar Bluffs stabilization work. Next slide. Now, Sandag has continued to work with North County Transit District, our state and our federal partners to improve the speed and capacity and reliability of that 60-mile segment of the low sand corridor that runs through our region. And this region really benefits from this vital link for both passenger and freight service, as well as being a real strategic asset to our region's military. Next slide. Now, so far, our team has completed 4 of 6 phases that are needed to stabilize the bluffs, which support that rail corridor through Del Mar. Now, a little more than a year ago, Sandag NCTD partnered with Secretary David Kim of the California State Transportation Agency and identified $100 million to fund these last 2 phases. And so I'm really pleased to share that we've been successful in receiving the funding that we need. Now, together with our partners at the federal, the state, and the local levels, we've identified this funding that we'll need to be able to stabilize these bluffs for decades to come. But that work is not done. It's critical that we move forward with really a long-term solution, and that would involve moving the corridor off the bluffs. Now, bluff retreat is accelerated by climate change and sea level rise, and it means that a realignment of the tracks off the bluffs is inevitable. Last fall, our board approved $3 million to start that work, looking at a long-term solution and to help bring more information forward on the range of alternatives. And we're going to be doing that with you later this spring. Next slide. Now, improvements on the low sand corridor will continue to be a priority in 2021 and beyond. As I mentioned earlier, the corridor is an important element for improving air quality, reducing congestion and emissions, and moving goods. Sandag recently received new funding for low sand rail infrastructure, and we currently have close to 700 million in shovel-ready projects that are now ready to compete for those vital and sometimes difficult to get state and federal resources.
So if I may, before you move to the next project, Ray, just for the board members. So on the Los Angeles corridor, and it is important for the board to remember, I think we made it a point in the last year and a half to, I don't know whether my video is working, but made it a point in the last year and a half to get the funding needed for the Los Angeles corridor. And for that, I want to thank everyone, especially our partner, North County Transit, Mayor Krantz and Matt Tucker. Moving forward, I would not recommend that the region spend another penny on short-term stabilization, because you can't find nature for so long. I think the long-term study that Ray has talked about is about looking seriously for this region for once and for all to address the Del Mar Bluff. And I also remind the board that this is a big part of the Los Angeles corridor, which is the second busiest corridor in the country for passenger movement. This is have a national significance. This is a goods movement corridor, and I think under the leadership of Mayor Gloria, when he was in Sacramento, we talked about this. This is considered one of the two bookends for the high-speed rail program. And there is a group right now led by former Governor Davis, talking to our existing Governor Newsom about potentially making the bookend funding from high-speed rail a priority. So we're hoping, and we want the region to be ready, that this corridor will be finally paid attention to. At least we were very successful in competing this time around. I want to thank Secretary Kim for that and his team, and a lot of our leaders, Atkins, Congressman Levin, Assemblymember Tash Borner, all of our legal leaders. But it is time for us to start thinking that simply we cannot continue with short-term solution and short-term fixes. And I hope this board will find it important and for the region to move with the permanent solution. Thank you, Ray. Go ahead.
Thanks, Hassan. So shifting our focus now to the border, wanted to take a look at the current development activities underway at the Otay Mesa East Port of Entry. The San Diego-Tijuana ports of entry are really significant transportation gateways and economic drivers for our large California Baja mega region. And for those of you not aware, the San Ysidro, Puerto Mexico is really one of the busiest international land ports of entry anywhere in the world. And you may not be aware, but the Otay Mesa, Mesa de Otay is the second busiest port of entry for truck crossings along our US-Mexico border. Next slide. Now, speaking of the economic activity, in 2019, we had about $48 billion of goods which crossed the region's ports. And given the economic impacts that these ports of entry provide both nationally, statewide, as well as regionally and internationally, the delays that we see at the border crossings are really costing our nation and the Federal Republic of Mexico billions of dollars in foregone economic output. Next slide. The shared region really is a defining characteristic, I think, for the San Diego region. And it's something that we're really pleased to be able to have the Consul General serve on our board of directors. And it really is describing the fact that our border is really a dynamic area that relies on cross-border transportation and cross-border collaboration. Now, the graphic that you're seeing here is just to display the array of projects that are underway that are helping to both build and support the new Otay Mesa East port of entry. And just to highlight a couple of these things that you see there in red, the State Route 11 Otay Mesa East port of entry project, it's a joint venture with us and Caltrans in collaboration with the state and the federal partners, both in US and in Mexico. And the whole idea behind this is to establish really a 21st century port of entry. The idea here is to really enhance mobility, reduce greenhouse gas emissions, continue to help fuel that large economic growth, and bolster binational trade. In 2021, we're going to continue to focus on securing agreements now with the federal agencies to both staff, maintain, and operate this new port of entry, as well as agreements with Mexico so that we can actually implement the financial strategy that is thought to include a tolling, revenue sharing, as well as binational operations through a congestion pricing strategy. And we'll be diving deeper into that one more in just the coming months, as I mentioned earlier. So San Diego is the only large US city without a convenient direct connection between public transit and the airport. And the Central Mobility Hub project will address that shortfall here in our region. A Central Mobility Hub was included in our previous regional transportation plan, but the concept now is being really refined and further developed through the development of the 2021 regional plan. This project will include multimodal transportation hub for the future with connections to heavy rail, light rail, our regional bus routes, improved active transportation routes, and a direct connection to the airport. Now, two potential sites are being considered. You've heard maybe a lot about the Navwar site, as well as the Intermodal Transit Center, which is located between Interstate 5 and Pacific Highway, just south of Washington Street. And you can see the two stars on the map there that are indicating those two sites. Next slide. Now, the US Navy has been exploring the possibility of providing the existing Navwar property in exchange for a new cybersecurity facility to meet their mission requirements. We've worked quite a bit with Joe Stuyvesant and his team, and those conversations continue regarding placing a Central Mobility Hub at this location. Now, regardless of where the Central Mobility Hub is located, one of the exciting potentials that we see is to promote infill development, as well as to be able to provide an expanded tax base. Next slide. Now, the next steps for this project will be to continue those discussions with the Navy on a potential land transfer. And that action is really connected more to the Navy's preparation and release of an environmental document that's underway for their facilities in looking at the transit-oriented development that's being considered for that Navwar site. Now, concurrent with that, Sandag is going to be environmentally clearing the Central Mobility Hub with both the Navwar site and the ITC site still being considered as viable alternatives. Now, the Central Mobility Hub is anticipated to include a direct connection to the airport. Now, provided the Navy selects one of the alternatives with a transit center at the Navwar site and reaches agreement with Sandag on a fair and equitable land transfer solution, then there's a potential for a P3 or a public-private partnership procurement, which would help to generate the revenue that's going to be required for the Navy's cybersecurity facilities. So the last priority project I want to talk to you about is arguably one of the most pivotal activities that Sandag engages in. In fact, it really helps to set the course for our region's future. And we're really trying to seek a better alignment between our transportation and land use policy and the accompanying investment strategy. And underlying all that is our interest, as Hassan had mentioned in his earlier comments during the executive director's report, to provide compelling transportation options that are going to serve generations to come. Next slide. Now, the vision for the 2021 regional plan really reimagines the transportation system based on what we refer to as the 5 big moves. This is really a set of inter-reliant strategies that make up a transformational transportation system and will help to really reshape our urban form. Next slide. Now, the vision that we've been working on the past 18 months reflects a new approach to planning. Our team accessed new sources of data They researched the latest innovations and incorporated input from diverse voices as they sought to apply the 5 big moves to our region. Our vision really aims to address 3 challenges: traffic congestion, social inequities, and meeting our state and federal mandates that require the reduction of greenhouse gas emissions and the improvement of air quality. The whole idea here is to have a resulting transportation system that's faster, fairer, and cleaner. Next slide. Now, addressing social equity in the regional plan means improving access for our minority, low-income, and senior populations. It's access to quality jobs, access to education, access to healthcare. Now, the figures that we're showing here are trying to describe the densities of minority, low-income, and senior populations in our region. The darker the color, the higher the population. So if you can advance the slide, when we see the layer network on top, you're going to see how the proposed transportation system is really seeking to improve connectivity with all of these critical communities. Now, the regional plan, when we bring it forward to you, is going to also include a social equity framework. And the whole idea behind that is to really ensure that equity is considered throughout the planning, the policy development, the development of resulting programs, and all of the projects. Now, on the next slide, we've got some animation here to kind of help you visualize a little bit more about the 5 big moves. But when we apply that 5 big moves to our region, you're going to see a connected system of managed lanes. And we're doing this without any roadway widenings. Next, we've got improvements to the rural corridors. These are really focused on improving safety as well as creating critical evacuation routes. We're envisioning a fully connected high-speed commuter rail network. We're imagining a whole series of light rail extensions with next generation rapid services to increase those connections and the frequency of services. And then finally, what you're seeing appearing are mobility hubs. And these are our centers of activity. This is where the communities come together. This is where access to high quality transit service is now enriched. And a lot of that's being done through what we refer to, one of the 5 big moves, our flexible fleets strategy. Now, throughout the region, layered across all of this is something that Hassan had referred to earlier, and that's the next operating system. And this really is, if you can imagine, a technology layer that allows this whole system of 5 big moves to work seamlessly. Now, as we try to concentrate our investments in the western third of the region, we're also able to preserve valuable open space. And your team is currently at work putting together all the details and completing all the analysis that's going to help to turn the vision into the 2021 regional plan. And we look forward to working with all of you with all the exciting details that are going to come up. And so to kind of wrap up the overview and get ready to hand things over to Andre, I just wanted to remind you that over the next months now, it's going to be a very busy time for all of us. We're going to have the directors return with deeper dives into each of these 5 priority projects, like I mentioned. And beginning on February 12th at your board meeting, we're going to now start the more comprehensive set of conversations, which will carry all the way through into the summer, helping us focus on taking the vision and turning that into the regional plan. So with that, I'd like to turn this over to Andre Dujan, your CFO. He's going to provide an overview of some critical finance actions that we're going to also ask you to consider at your upcoming meetings here throughout Q1.
Ray, can you hear me?
Oh, yes. I'm sorry, Hassan.
Yeah, okay. All right. So before you leave to Andre, let me just mention one thing to the board of directors. So on the 4th priority, the mobility hub, the NAVWAR project, I just want to remind the board that last year, a few months ago, we done something that San Diego really never able to do, and the state of California has been done once in the LA area, and that is pass through the legislators and have the governor signed a CEQA reform bill. And what's so special about this, authored by none other than our mayor now, back then Assembly Member Gloria, it passed unanimously through the House and the Senate and was signed by the governor. Again, never happened in San Diego, and only the second time it happened in California. And the reason I'm bringing that up is we have an opportunity to not only provide connection to the airport and build the biggest transportation hub in the region, but we have an opportunity to actually reshape the economic future of the region or the whole Midway district. And first of all, we're very grateful for our mayor for authoring the bill back then and passing it. It's not easy to pass these kind of bills. And second, grateful for the leadership from the Council President Campbell. This is her district and others. But this is a project that where I earlier mentioned, and I couldn't thank enough Joe Stuyvesant and his team at Navy Southwest. We signed an MOU with the Navy. We're moving forward with the work. We're very much hoping that the next leadership at Navy Southwest will be committed as Joe was. But this is a project that's going to require leadership. This is one of the most complicated projects for sure I've ever worked on. But this is probably the most exciting project I will ever work on. And I would look for your leadership, because this is the time when we need, like the mayor said, it to be a big region, a big city with big ideas. Challenging, yes. Exciting, absolutely. It's going to cost a lot of money, yes. But this could actually be a project that could reform the whole San Diego region. And I hope you pay attention to the activities as we move forward with this project. And again, I want to say thank you to Joe Stuyvesant, because without him and his leadership, we could not be where we are today. Andre, go ahead.
Thank you, Hassan, and thank you, Ray, and good morning, board members. So we do have a very busy first quarter of proposed financial transactions to continue to support all the various programs and projects that Ray just described. We thought it would be helpful to highlight the proposed issuances within our debt program and review our budget schedule that will be coming to our committees and to the board over the next few months. I actually have just one slide to share with you today, and if you could move forward, please. So in November, we presented an item to the board that described the potential shortfall of the transit funds of approximately 170 million to 220 million over the next 5 years. We presented a number of strategies for the board's consideration. One of the items for consideration was to refinance existing bonds to lower borrowing costs and issue new bonds. This opportunity was created since the Federal Reserve slashed interest rates in response to the COVID pandemic, which started last year. Now, in November, through a competitive procurement process, we selected our financial teams who will assist in the proposed transactions. So at the next January meetings, we'll present to the Transportation Committee and to the board an overview of the two transactions that we are currently working with two sets of financial teams. The first will be the refinance of 537.5 million of bands or bond anticipation notes, which are short-term notes that will be ultimately taken out by the TIFIA loan. The second transaction will be a refinance of approximately $150 million of the 2014 series bonds, along with the issuance of $85 million in new money. We will then come back with final documents in February, and with board approval, we'll go to the bond market and expect to close transactions by early March. At the same November meeting, we also discussed replacement of our current undrawn TIFIA loan, which is one of the financial instruments that will fund the Mid-Coast Corridor project. The only thing that is changing in the loan documents is the new lower rate, which is expected to save over $100 million in interest costs. We anticipate closing on the new loan later this month. I'm pleased to say with these issuances, we'll resolve about half of the shortfall I just mentioned. Now in March, we'll also bring an item to the board recommending that we expand our commercial paper program from the current $100 million up to $200 million, which will give SANDAG and our member agencies some short-term flexibility in funding needs. With a very low interest rate environment, the all-in borrowing cost is under 0.5% for our commercial program. Turning to our attention to the green boxes in our budgets. When the board adopted our final 2021 program budget in June, we're in the beginnings of the COVID crisis. And although we were fairly confident that we would receive our federal and state funding that were previously appropriated, we're not as certain about the local funds and how those would be impacted. As a reminder, our local funds make up about 50% of our $1.2 billion annual program budget. So we committed to come back to the board on a quarterly basis and give an update and amend our budget as necessary. In February, we'll be coming to the board with our second quarterly update. And the good news is that our local sales tax has done much better than we had forecasted. We had projected that this year we would be down approximately 7% over fiscal year 2020. However, as of December, or 6 months into this year, fiscal year, we are up over 1.5% over prior year. The main reasons for this increase have been due to the Wayfair decision over a year ago that allowed us to collect local sales tax on all internet sales, which are very strong, and the fact that consumers who could not spend their dollars in the service sector during COVID turned their spending to taxable goods, which benefits us. So at the February meeting, we'll be recommending that we increase our TDA and transit budgets to reflect the actuals that are coming in. This will be a relief to our member agencies, particularly to the transit agencies who have seen the biggest decline in revenues. In March, we will bring our draft fiscal year 22 budget for approval, with the final budget coming in May. As of now, Ray Major and his economic team are projecting further increases in local sales tax in fiscal year 2022. Madam Chair, that concludes our presentation, and I'll turn it back to you for any board questions. Thank you.
Okay, thank you. I just wanted to first ask Francesca, our clerk, if we have any public comments.
No, Chair, I don't see any hands from the public.
Okay. I did see that our supervisor, Joel Anderson, has joined us, and I just want to give him the opportunity to say hello to the board.
I'm sorry, this technology is, I'm not up to quite speed. I've been on for a bit. It's great to be here, and I look forward to working with you all in the future. And thank you for the opportunity.
Well, thank you. Welcome to Sandag. Okay, so now I'll call on Councilmember Rodriguez.
Great. I'm having issues with my video. I apologize. So can everybody hear me?
We can. Thank you.
Okay, perfect. Thank you guys so much for the presentations and the information on the vaccination. I look forward to bringing that to my other colleagues and city, and partnering with the county on getting those out as soon as possible. In reference to the last presentation and just my due diligence in the priorities for this year and going back the last probably decade, first, I really appreciate a priority from Sandag and the county on looking at equalities and looking at communities of color. I know here in North County, we have very, very large communities of color, and the medium income levels in North County tend to be lower than other parts of the county. And our constituents here in North County, we spend tax dollars toward infrastructure just like everybody else, but we've been neglected here in North County from Sandag's priorities. We have the 78 corridor and we have the 76, and you may not travel up north to experience the lack of infrastructure, but those community of colors and those equalities are not being met. And an equal share of those infrastructures are not being met up here in North County. So I would just like to bring that forward. I know we're not making any major decisions today, but it is something when we do discuss equalities, when we do discuss communities of color, that we do not neglect our North County neighbors with future infrastructure.
Okay, thank you. Well, now we'll go to Mayor Jones.
Thank you, Chair Blakespear. First, I'd like to say I'm really happy to see us continue to refinance our bonds when possible. That is, we at the City of San Marcos do that quite frequently, and it's really saved the taxpayers a lot of money. So I'm really happy to see that. And I'm really excited to see that we are finally going to get the Mid-Coast completed. That's really important, I think, to our county. But also what Councilmember Rodriguez had mentioned, in the spirit of collaboration and equity, and also taxation equity, we need to make sure that we are following our priorities that we set. And so we had set last year as one of our priorities the corridors, the 78, the 67, the 125, 94, and then also the 52. And so I just want to make sure that we don't lose those off the radar, because there are a lot of businesses in both East County and North County that really depend on those as far as getting people moving around in regular cars, but also electric cars like myself, and then also really moving goods. And so I just want to make sure that we are continuing that as a priority. And if we decide to change that, we need to have the discussion here at the board. So just wanted to bring that up. I know this is just a discussion item, but I think it's very important that North and East County also has a voice at the table, and that we have the equity that the rest of the county has. So anyway, thank you for allowing me to speak.
Thank you. Does staff want to respond to that about the timeline or the future opportunities?
Sure. Thank you, Mayor Blakespear, and thank you, Mayor Jones and Councilmember Rodriguez for your comments and questions. Let me make it very clear that in the regional transportation plan that we're developing right now, there will be a draft plan out in April, in 3 months. And nobody is changing priorities, but we're gonna have to put a plan that meets the state and federal requirements. I said that since I started, and I say it again. We're gonna meet or exceed the state and federal requirement, reducing greenhouse gas emission. We'll also have a new criteria. That's social equity and social justice. Any project is gonna be subject to that. If that means changing priorities, so we'll present it to you and you will make a decision. But nothing is gonna stop us from, one, we must meet the requirements, and two, we must comply with what you're gonna look at in the 22nd, which is the social equity. That for sure is gonna change the priority projects moving forward, no question about it. And my staff and I would bring it to you, and you will make a decision moving forward. But for now, I look forward to working with you between now and April before we release the draft. But once we release the draft plan, the project will be presented, and then you will make a decision about them.
Okay, thank you very much. Encinitas Deputy Mayor Kranz.
Yes, thank you. And I just wanted to take the opportunity to comment on the presentation and the prioritization of efforts to stabilize the bluff in Del Mar for the low sand corridor. I think everybody on the board is aware of how critical that piece of infrastructure is. I think everybody's also aware it's about 130 years old. So it's an area that has long been a subject of discussion, and specifically about how to get the rail corridor off the bluff. And the challenge, of course, is the cost of doing that. And so I do expect that in the months and years ahead, there will be robust conversation about that specific issue. But in the meantime, it's vitally important and a high priority at NCTD to ensure that the corridor remains open by stabilizing the tracks in their existing location. And while I appreciate Hassan's pledge not to make any further investments along the coast, it is my hope that as a policy body, we can remain focused on the need for the safety aspects of that corridor, and with sea level rise constantly challenging all of us coastal cities and that particular piece of infrastructure, that we would remain committed to keeping it open regardless of what happens with the conversation regarding tunneling through Del Mar. So with that said, there are several other NCTD projects that have been advanced to the point where they are shovel ready. So it is my hope that as we see a new administration take their place in Washington, D.C., should there be any infrastructure bills that would provide us the opportunity to advance those projects to construction, it would be my hope that Sandag would be prepared to advocate for that. And I look forward to the continued enhancements to the low sand corridor so that we can continue to improve transit opportunities, headway times, and attract more riders to that corridor. Thank you.
Chairwoman, and thank you, Councilmember Krantz, and always appreciate your leadership in North County Transit, and appreciate working with you and Matt. Let me make sure we're clear. We're never going to compromise safety for our residents. That's given. Having said that, I also want to make sure I'm straightforward with you. We just secured money to stabilize Bluff 5 and 6, and we all worked hard to make sure that money is there. And we're going to do that. We're going to put piles on the ground, and we're going to put seawalls. But to me, if we're going to continue with that, and every few years going to say, oops, we have a rainstorm and we need to stabilize, it's not going to work. And I think this region needs really to commit. I know it's going to be expensive and difficult. And I've been hearing every time you mention we're going to move the track or tunnel, oh, it's expensive. Well, anything that's worth anything is expensive. And I think this region needs to make a decision whether we're going to solve it once and for all or not. But I will never, ever recommend that you compromise safety for our residents in San Diego.
Okay, thank you. Councilmember or Mayor Sotelo Solis.
Thank you. I, again, just want to stress that through the priorities, the connectivity from the border to UC San Diego is a great priority. And the fact that we are more than halfway there on time, and I believe you said under budget, right? We're under budget. Fabulous.
On budget, I'm sorry.
Budget. Okay. On budget. I think that's just as good. I think that all makes sense, because when we start talking about north to south, or should I say south to north, we also talk about north to south. So they can, people from all parts of the county can make it, whether they want to go to Tijuana or National City or San Isidro or Chula Vista or Imperial Beach. Our communities can also go up to the UTCs and the university opportunities up north. So I'm very, very happy to hear that. I think when we start talking about the equity lens, and I just want to read something from the social change website, and it says, equality versus equity. The difference between equality and equity we need to emphasize. Although both promote fairness, equality achieves this through treating everyone the same, regardless of need, while equity achieves this through treating people differently depending on that need. And the first part of our meeting conversation was the vaccine rollout, and then the conversation about those communities that have been, adversely impacted. And we need to have those lenses on as we talk about priorities for our Sandag, whether it be, the connectivity for our flexible fleets, partnerships with MTS, partnership with NCTD, working with the Navy, and recognizing that there have been decades of discrimination and impartiality to specific communities. And this is one way to move towards equity and equality. I just really want to urge my colleagues, when we have those lenses, it gives us the opportunity to have challenging conversations. It may be uncomfortable, it may feel awkward, but when we all succeed and we all are at the starting block at the same level, which we are not all at, we can then see our region continue to succeed. And so again, the difference is that equity achieves this through treating people differently depending on those needs. And the one closest and nearest and dearest right now is COVID-19. There's specific communities statistically, scientifically have been proven that have been disproportionately impacted to other communities. So as we move forward, again, this is part and parcel to 2021. And I look forward to the leadership of our chair and our CEO to help and guide our discussions, along with where the money is going to help us in getting to that equity. Thank you.
Thank you. Mayor Dedina.
Great presentation, and really excited about OTI 2, and just about the cost of doing things. We've seen globally and in this country what it costs not to do things. What it costs not to deal with the pandemic. I've seen in Imperial Beach what it cost when people made up lies about Tijuana River pollution and told us everything was fine for years and years and years. And we're still pressuring the federal government to get the sewage infrastructure built to stop what today is 50 million gallons a day of raw sewage going into the ocean. And I say that because my feeling on Del Mar is whatever it takes to fix that permanently, let's get it done. We've seen with this pandemic, when the federal government wants to do something, they can do it immediately. This idea that government's supposed to take years and years and years and years of inane meetings where people spend all their time talking about the same thing is out the window. It's literally killing the planet, because we've done the same thing on climate change. And so the California is burning and we're still having meetings and figuring out how to spend money in 3 years. So let's figure out how to get these projects done, not what it may cost us in 10 years, but to get it done right now, and the fastest way to do that. And Sandag really knows how to do that. So, the San Elijo Lagoon project, for example, we're preserving public space. We're doing natural climate solutions. We're restoring a wetland. We're helping restore a highway. It's arguably one of the most innovative and sort of like multifaceted projects on the planet. It's actually a great model. So is OTI 2. OTI 2, we're going to reduce emissions. We're going to help people cross the border. We're going to improve the quality of life. And we're going to make sure that kids have less asthma in the South County. So we know how to do these things right. We just have to get the federal government and our state partners to do things faster. We need to get over this thing that somehow if we spend this money now, it's going to cost a lot of money, because it's going to cost 10 times as much if we wait. So let's as a commitment, as a board, let's figure out how to get things done a lot quicker. I'm frankly very unsatisfied with the way that Sacramento does business. I think in San Diego, we can commit to moving very quickly to solve these problems, so we don't have the same conversation for 10 or 15 years or 20 years like we did with the airport, right? It's still ongoing. So, and I've seen that personally with me with water quality, where in the Tijuana River, where we keep having the same conversation instead of just getting things done. So 3 words: get things done. And I'll say the 4th right now is 5th. So anyway, with that, I'm committed to helping you guys get things done. And if it takes me being the bad guy, and like I said the other day, the cranky coach, to keep pushing on it, I'm glad to take the heat. But man, I am so tired of people talking about why we couldn't do things or how much money things cost. We live in the wealthiest country on the planet, so we need to spend a little bit more to get a bit more. And so we can get the hell out of this pandemic and get back to doing things that we love to do, rather than sitting on a Zoom screen talking about why the world's so screwed up. So there you go. Thanks.
Thank you, Mayor. That's every mayor's mantra, is get things done. Council President Campbell.
Thank you very much. I want to thank the staff for the great presentation, and Hassan also for your explanations.
Oh, could you try to speak up a bit? It's a little bit light.
Oh, I'm so sorry. Let me see if I can turn
That's
my
better.
volume up. Is that better?
That's better. Mm-hmm.
Okay. This is one of those old city computers here that I have. So I wanted to thank staff and Hassan for the great presentation and the great explanations of all the priority projects. This is so helpful to those of us who are new to the Sandbank board. I'm especially excited about the Navwar site and about our future because of the development of that area. This is in my district, as Hassan mentioned, and also it is right next to the Midway area, which is also in my district. And as many of you know, the city voters just passed Measure E, which has made possible change in the zoning height level for that particular 900 or so acres. And that is right next to the Navwar area. So I just want to say that I think the chance for improving our amount of housing, our modernization of that area, the new transportation center, making it easier for us to get to the airport, which is just so close to there. I just think it's a wonderful idea, and I'm really excited about working along with Sandag to get this project moving along. And I agree with Mayor Dedina, as fast as possible. You know, I am a physician and I'm used to having everything done the minute I order it. And so it's been a little difficult for me to get used to government, but I am getting used to it after a couple of years. And if I could just say a couple of words about COVID. I know it's going back to a different topic, but I wasn't able to find my hand to raise in this old computer before. So I just want to say, after 40 years of being a physician, I have a little bit of experience with this. I'm probably by far the oldest member of this board. When I was a little kid, we had the polio vaccine invented. We all stood in line outside our local elementary school, and the entire nation was vaccinated in about one weekend. I think the reason for this is because we had millions and millions of vaccine doses available at the same time. Currently, we do not have that. But I think once we get our new administration nationally, I know that Biden is committed to making sure that we get millions of these vaccines made and distributed. And then in the meantime, as the county people are doing, and as we are all trying to figure out how to get this set up so that we can march people in, give them their shot and get them out there and get them healthy, and then give them their second shot a month later. I know that we're going to be able to do this. It's a matter of speed and getting it done. So thank you. Thank you to all of you. And I hope I can help in any way possible.
Well, thank you, Council President. We'll go now back to Councilmember Rodriguez. He has his hand back up.
Yes, sorry. I just, after a few of the additional comments and Mr. Hassan's comment, I wanted to just, I guess, just reiterate one item and in a sense, plant a seed. Looks like there's going to be some shortfalls on projects and funding for Sandag, and the conversation of, taxation is going to come up probably rather quickly. And there's a growing frustration, I know, in North County, as stated before, of the lack of infrastructure. So when those conversations come up, I just want the Sandag staff and Mr. Hassan to be able to present what has been done with the tax dollars to help the infrastructure in North County if you're going to be asking for additional taxes in the future. That's going to be a big question that will come up, and it doesn't have to be addressed now. I just want to present that because it's going to be very hard to get North County support for additional funding when we've lacked it over the last decade from Sandag. Thank you.
Okay, thank you. So let's see, do we have any other member comments? I don't see anybody's hand raised. If you're having a hard time raising your hand, you can just put your hand up like this and I'll take a look for you. I don't see anybody. So I think that means that our meeting is adjourned. I think I just want to say thank you to staff for putting together two great informational presentations for this first meeting of the year. And we're all looking forward to working together. So with that, our next meeting is on the 22nd at 9 a.m. and we are officially adjourned.